Asthma is a chronic inflammatory condition affecting the respiratory system, marked by bronchial hyperresponsiveness, acute exacerbations, and reversible airflow obstruction. Common symptoms include wheezing, coughing, and breathlessness, typically emerging in childhood, alongside conditions like eczema and hay fever. While the exact causes remain complex, asthma is understood to stem from both genetic predisposition and environmental triggers. The disease process begins when irritants or allergens provoke an immune response. This leads to three key changes in the airways: inflammation, mucus overproduction, bronchospasm. Over time, chronic asthma can cause irreversible airway remodeling, thickened membranes, collagen buildup, and fibrosis. Eosinophils often infiltrate in persistent cases. Thankfully, modern treatments prevent many children from reaching this stage. Triggers fall into two categories: avoidable, smoke, allergens, irritants, NSAIDs, beta blockers; unavoidable, infections, exercise. Weather changes. Diagnosis varies by age. Young children, clinical history plus bronchodilator. Response: older children, adults. Spirometry, showing reversible obstruction. Treatment follows a stepwise approach. Relievers: short-acting beta-agonists. For acute symptoms, prevent corticosteroid inhalers. Advanced options: leukotriene and anti-eosinophil biologics. Non-drug management is equally critical. Proper inhaler technique, personalized action plans. Trigger avoidance. Acute asthma is a medical emergency, classified by severity: mild, moderate, speaks in sentences, 0 to 94% severe. Uses accessory muscles, 2,99-94%. Life-threatening. Silent chest, confusion, 0 to 90%. Emergency treatment escalates accordingly. Bronchodilators. For oral steroids, magnesium, aminophylline, or epinephrine. Ventilation support if needed. In summary, asthma is a reversible, but potentially dangerous, inflammatory condition. With proper medication and lifestyle management, most patients achieve good control. Use doctor's #1 recommended product. Breathe for all type of lungs issues. Link in comment section.